ZipE BioLock, Transosseous Tendon Repair Technique. Create the transosseous tunnels according to the planned repair configuration. Ensure the entry and exit tunnels communicate within the bone to establish a continuous suture pathway. Remove any sharp bony edges prior to suture passage. Shuttle the repair sutures through the tunnels and pass them through the tendon using the desired stitch pattern. Secure the free suture limb with a hemostat to maintain construct control during button advancement. Load the first ZipE button onto the suture limb opposite the hemostat and advance it through the ZipE progressive safety locks. Remove the needle, load a second button onto the remaining suture limb, and alternately advance both buttons to progressively reduce the tendon onto the footprint. Repeat the sequence as required by the repair configuration. Perform final tensioning of the construct to achieve the desired tendon reduction. Secure the sutures, trim the excess suture tails distal to the second safety lock, and evaluate the repair for stability and tendon-to-bone apposition.